Yes. Hello and welcome to Psych Talks 2.0, Season 2, where the show where we believe in listening, learning, and empowering. I'm your host, Dr. Arshia Nulla here. In today's episode, we are talking about oral health because today is World Oral Health Day. So, here we have our guest, Dr. Aisha Nilofer. She is a dental surgeon and she has pursued MDS in oral and maxillofacial pathology, and she is a gold medalist. So today we are talking about oral hygiene and many facets of it, and much more. So let's get started. First of all, thank you for joining the session, and we warmly welcome you to our podcast.
I would
Moving
gladly
on.
accept your invite. Thank you for the invite.
Okay. So, doctor, can you first explain what are the best oral hygiene practices which we can follow in our daily lives?
To put it in simple terms, dentistry is something everyone knows, but most of the people don't follow. So, when a person comes to a dentist, what we tell them, it is rule of two. Rule of two meaning like you need to brush twice a day, once in the morning, once in the night. Very specific. It's not key any time in the day you do twice and you are like two times is done. Once in the night, once in the day. So two times a day, followed by brushing will be done only for 2 minutes, that is 120 seconds. The another two will be, you will get it checked with the dentist every 6 months. You'll have a review, like twice in a year you'll have a review. This is the rule of two, which ideally everyone needs to follow. Post which the others come when the brushing is done right. And next step will be gargling, like you need to gargle after every meal you are having. And you suppose you have had some junk which is stucky, like which is very sticky and high sugary, then you can obviously rinse your mouth. If you're not at home, you're out, you can at least take a gulp of water, do a minute rinse, and then take up the water inside. And more sophisticatedly, it'll be going for flossing. Flossing is very important to avoid interdental debris, to clear up whatever are there in the day. Once also is enough, depending on individual. But doing flossing will prevent you from getting a lot of cavities. So this is all will be the basic maintenance which we will emphasize. And everyone needs to do it. It's very important there.
So, what are the most common dental issues encountered in daily practice?
Majorly, if we see, we categorize it like first thing what we see is cavities, because of course people come to us only when they have pain. So the highest number of encounters we see is cavities, decay, and infections. Second, most common being gum issues, which are more than like we see they are very much neglected. The people come to us when they are much worse. So ideally they have to come to us when they have mild sensitivity or when they have gum bleed in itself, but they neglect it to a criteria where the teeth are mobile and everything is gone par our hands. So I think it is much of a neglected issue comparatively. So dental cavity people at least come back, but gum issues it is very much neglected. Third, right now India is becoming a hub of oral cancers. So right now, in the past few years, we have seen quite a increase in oral cancers in younger age groups also. So these three we are fighting with right now.
So, coming to the issue of sensitivity, as you have mentioned, what is actually sensitivity in teeth? What causes it? And sometimes people ask when we are in clinical practice, people ask us, does cleaning teeth cause sensitivity or it increases the sensitivity?
Okay. So I'll try and answer the question one by one. First, it is what causes sensitivity. So basically, the first thing is we all need to accept the fact and believe in the fact tooth is a part of a body. Tooth is an organ also. Tooth is also living in with us. So people basically think tooth is like a nail you can cut and throw. It's an appendage. No, teeth is linked with a lot more things. So right now for this particular question, I would like to explain you a little more better. So once you see this is the outer layer. Whatever you're seeing, the white color one is actually enamel. This is actually a totally non-alive layer. It has no blood supply, no nerves inside. But when you turn into it, see the inner mild yellowish or orangish color is dentine. Dentine and the inner layer is pulp where the nerves and blood vessels of the tooth are. So till in the enamel is good in your tooth, you'll not feel any sensitivity. But once the enamel is eroded or rubbed off, being with multiple factors, you don't have a single factor. Even improper or aggressive brushing is also in itself a factor to wear off your enamel. So once the enamel is weared off, there is no chance to get your natural enamel regrow. Anyone who is telling your enamel will regrow, that's not happening. You cannot believe it, you cannot buy it. Dentine is something which is close to the nerve and it can regenerate. It is where dentine is actually tubes. There are a lot of tubes. So once the tubes are open, you take sweet food, you take sour food, you take cold food. These three are the main indicators first when sensitivity starts. So whenever this tubular balance changes, it gets into sensitivity, because there is where the nerves are starting in the tooth. Anything which touches the nerve, as in you get injured in your hand, you have a cut, you keep the hand below the tap, it starts irritating because the nerves are open when the skin is cut. It is like that in the tooth. Enamel is like skin. Once it is gone off, the barrier is gone off, whatever touches your tooth may give you sensitivity. So it is always better to protect your enamel as much as possible with many more precautionary ways. And coming to your second question, being do scaling. What you mean with cleaning is scaling. We call it scaling. Scaling is a procedure where we don't actually try to take off anything from your tooth. A layer over your tooth, a soft layer, a hard layer, depending on how long it has been, is being formed on your tooth. Also between your teeth and your gums. Sometimes between your teeth and your gums also the layer goes down. So this scaling, and particularly what we do is we remove this layer of debris, dirt, because this debris are not only dirt. There are a lot of microorganisms sitting in the dirt, so they cannot stay. Your gums also have a lot of blood supply. All these toxins from the bacteria gets into your bloodstream, and they can also cause the aggressive one like infective endocarditis. You can land up into infective endocarditis. Right now people who are going for cardiac surgeries are particularly advised by cardiologists, go get your teeth fixed, go get every scaling, everything done before you go for the surgery, because there is high risk to invade into blood. So I think scaling is nothing which will cause sensitivity. Utterly I would like to tell scaling is very important, but I will not tell repeatedly keep on going on and on. Do a scaling, learn how to maintain them. Whenever needed, get it done back. It's not like it's a routine key you keep doing. You can actually maintain. Most of the dental things are preventive. Once you listen up and get exposed more, they are all preventive mostly. So scaling is causing no sensitivity. So this is the biggest myth. I want everyone to take this out of their brains. Yeah.
So, can you shed some light on teeth whitening? Some people come and ask us, is teeth whitening a permanent solution, and what foods cause teeth whitening? And are there some foods which can cause stains on teeth?
Yeah. So teeth whitening is basically now becoming a aesthetic procedure. Like everyone wants to have milky white teeth, moonlight white teeth. These are all the terms we hear in our practice also. I want such kind of a teeth. So basically, if you go, the tooth color is also playing a major role when you are even before your birth itself. It is all decided. Your eye color, your teeth color, everything is decided. Usually, only if you see African people, Zimbabwe people, all those races have comparatively much more whiter teeth than Asian and the like English people have a little yellowish kind of a tint of teeth. That is natural. So I think whitening is required in cases where fluorosis, heavy fluorosis. Some people, some regions are very much susceptible to fluoride in their water content, and they have very much discolor teeth and all. That is a major cause, and we'll have to do it. But otherwise, also we do like teeth whitening. But teeth whitening is never a permanent solution. They are permanent solution also, but something like what actors and what most of the models and all tend to go like for the wedding and all, people go like basic teeth whitening. That is a temporary solution. That is never a permanent solution. When we are doing it, we give you a particular guideline to follow, like, listen, you're going to avoid these so and so foods, you're going to maintain so and so ways. That is when this is going to prolong. We never can give you a guarantee or a word of mouth ki, now you have done a whitening and this whitening is going to stay with you for quite a year, 2 years, 3 years. No, it's not a time limit which we frame. It is how the patient takes it up, how carefully they're going to follow the instructions, how they're going to maintain what we have told. It all sums up like that. And there are no particular foods which can cause teeth whitening. in particular. Magar, there are a lot of foods which can cause discoloration. So with that, actually, one major reason for tooth discoloration be a lot of colas, beverages. Actually, these wear up the upper layer of your tooth. So when enamel is white, it's gone. The inner layer is yellow, dentine. So of course, your tooth will start looking yellow. Aggressive brushing, when you do, your teeth will start looking yellow because the upper layer is gone. With cavities, the teeth can go yellow. The other reasons being coffee stains, smoking, the majorly smoking, tobacco, all this causes a lot of issues. And something to be majorly worrisome is you had a normal color of teeth, which is changed gradually to a darker color or another color. Then you need to address it then and there. A particular tooth is what I'm talking about, not the overall one. So it goes like that. But teeth whitening is never a permanent solution.
So, how frequent should a person visit a dentist, and how frequent this teeth cleaning should be done, the scaling should be done?
According to my first answer, according to the rule of two, visit us every twice a year, 6 months a year. For pedo patients, like for the kid patients, right now we are advising them to visit to us every 3 months also, depending on how the oral hygiene is. The first thing we are trying to emphasize with the frequent appointments in the kids is the kid gets accustomed to us, because every first appointment they don't try to get into and get involved with us. So we are trying to accustom them. The more they are having visits, the what happens is we can address the issues in much more earlier stage. We cannot let them progress for a pretty bad and worse thing. So people would find it easy and painless. Dentistry is something, more than any other branch of medicine, we are working with a human who is awake. We are drilling, we are cutting, we are doing everything when you're awake. You're not asleep. Even when we give you local anesthesia, you're awake. You are understanding and you're listening to everything, and we are working on it. So I think the person needs to get accustomed to us and have total faith and trust in us more than anything for us to be calm on the seat. So for the pediatric patient, we are trying to reinforce it like that. But for the adults, and no matter what, looking into 6 months once is mandatory to avoid any major issues. And you came with 32, it is very much important you go back with 32 also. We cannot tell like I have 10 fingers, I'll give off two fingers can go, we'll have just eight. It's not like that. There's no compromise. So you need to hold on whatever you have. So it's important you go for regular visits depending on your hygiene. Some patients, like geriatric patients, also we are right now telling come back 3 months once, because their muscle tonicity goes. Once the muscle tonicity goes, the food gets deposited between the teeth and the gums and all. So they develop frequent. They would have come to us before 2 months. They wouldn't have had a cavity. But once they come after 2 months, they'll be like, no, I feel pain here. So they develop a lot of issues due to the aging and all factors. So yeah, depending on an individual, we properly time them up. We can give them particular reminders also. Yeah.
Speaking about kids, so how frequently like kids get oral health issues? Starting from what age do you get pediatric cases in practice?
In particular, we have actually seen a kid of 1 month also, a kid of 7 months also. I mean, 7 days also we have actually seen. This is somewhat like the issue. The teeth starts developing when the kid is in the mother's womb itself, in the intrauterine life itself. So the issue can start from there also. Certain drugs in itself, which the mother takes, can have a lot of effect on the teeth which are developing. Many issues, we will not get into it because it's a very vast thing, but they can cause a lot of issues. And certain kids, when they are born itself, they are born with teeth. Certain kids are born with teeth also, but they are not needed. Certain are born with. So what do we do? Those kids, they are very young and they cannot take the feed itself when they have it. The tooth is mobile, they cannot take feed. There are a lot of issues. So then for this particular teeth, kids, we need to address them when they are by birth itself, like around 2 3 days itself. We'll have to address them because the kid needs to learn to properly suckle, and all this has to happen. And certain, we have seen by birth itself, they have cleft palates, cleft lips. So those are also majorly addressed by dentist, come oral maxillofacial surgeon. Then they go for high-end cleft surgeries and all that. So these are also addressed. The kid is first not done surgery. We give them obturators. There's something called obturators, which closes the space, and the kid can learn to suckle, talk, and move the tongue around. and they cannot regurgitate. Once the kid regurgitates in a very small age, it's very risky. So all this falls in our part. So we see the kid from birth also. And the most common being the kids nowadays, due to the food habits, and they cannot maintain hygiene. So we are seeing kids, the youngest, we have done root canal for the babies. The root canal for the babies is called pulpectomy. The youngest being 2.5 years is the one we have done, because 2.5, the age to complete the primary dentition is 2.5. The first molar develops a little earlier, so we are seeing them in 2.5 itself with cavity pain, and also we need to address them when they have complaints. So no particular age, parents need to take a lot of efforts right now in this generation with the kids. So yeah, the earlier any issue, the earlier the better. If we see them every 3 months, we'll know the cavity is there. If we see them every 6 months, we'll know something is there to be addressed. They will not get into root canal. We can address them with normal filling. The kid will be comfortable. Root canal is something we try to avoid ourselves also. So we don't want the kid to go to the worst. So we can prevent a lot of issues if we see them repeatedly. You can get your kid when you go to a dentist. You can take them. You cannot let us see them. We will not see them for the first 2 3 years, but they'll get used to the surroundings. So we can train them something like that, so they are not scared. People are associated in mind ki when pain comes, we will go to the dentist. This is a such a wrong scenario. Pain in itself is very disheartening, and you are having a feeling we'll go to them only when we have this. So that adds up the fear even more. And parents also sometimes they tell to the kids ki come, if you do chocolates, if you do this, we'll take you to the dentist, we'll give you injection, and we'll pull off your teeth. So in itself, when the kid is walking inside, they'll look at us like, oh, what is this woman or what is this man going to do to us? They are totally scared. And some kids avoid our contact. They don't even try to open the mouth. We give them 2 to 3 visits to get used to us, then that is when they let us work with them. So it takes a lot of efforts with the kids. So yeah.
Talking about dental caries, so can you
Mm-hmm.
tell me in a stepwise manner that what happens if a teeth erodes and if it is left uncared? Like some
Yeah.
people say, I had a bad tooth, a carie tooth, and it falls off by all by itself, even if it was eroded. So
Oh.
can you tell me in a stepwise manner what happens if it's left, it goes untreated, and what happens? What are the consequences of it?
So basically, as the layers I have shown you only. So first, the cavity starts in the enamel, white layer. You can see, like, if you feel your teeth with the tongue, you can feel a lot of ups and downs. So the tooth is not like flat key. Whatever you eat, it's gonna wash off. It's a little up and down. So of course, wherever it is very down, it is the layer, that part is called pits. So whatever you're eating sometimes gets stuck into the pits. So this is where the cavity initially starts commonly. So that bees in the enamel. Till then the food is getting stuck and all that, you'll not feel anything much about it, and it's neglected. So this is the first layer. So this layer is enamel caries. Then when it goes into the dentine, it'll start giving you a little more trouble. The food is getting stuck badly, whatever you're chewing is getting stuck, you'll start feeling sensitivity and pain. That is when people think I will go and look into. But then it is also avoidable. Right now people think Sensodyne can cover up all my cavities, so then they go with a easier option what they have. They'll tell, okay, I cannot chew on the right side, I'll chew on the left side. So they have a lot of options, because they are 32, so they try to avoid the procedure a little more. Further on which, when it reaches the pulp, I mean the nervous layer, then the pain is pretty bad. That is when the patient will not sleep at night. That is when the patient cannot do their normal course. That is when they think, now I know I need to go to the dentist. So that's when they come to us, till they decide. And even then some people are like, no, I'll go to the medical shop and get some painkillers. It's okay, I can bear. So they leave that stage also. At last, when they come to us, this is the bone and this is the nerve, they come with an infection in the periapical region, in the apex of the root. Then like, obviously, once the stages progress and progress, the treatment gets even more aggressive. We'll need to address it much better. The smallest cavity being can be corrected with a filling. We'll just fill it up. You can aram say go continue a day to your life. But once the cavity progresses, the tooth structure is lost too much. Once the tooth structure is too much lost and everything goes, the infection is on the root, then you'll need to go for a root canal. If the tooth structure is too much gone, then go for a crown. We are ourselves increasing the work for, like, the patient, also for us also. This is a distress for the patient. Also it becomes hard for us to work because lot of infected material, the patient is uncomfortable on chair, they're feeling everything and anything we are doing, they come up with a swelling. Once they come with a swelling, we cannot work on them immediately, so we'll have to manage them. So yeah, certain things do come with a complication. It's not a denial. Sometimes mistakes do happen from the practitioner's side also in misjudging and misdiagnosing. Certain cavities will look very calm and they'll not have pain. Once we fill in, they feel a lot of pain. Maybe sometimes it is deep. There was a misjudgment about the material. Lot of factors. So yeah, we'll need to go with a proper procedural diagnosis first to go what to be done to the patient. So dental cavities gives you lots of time. For it to get into pain, it will give you minimum 1 to 1.5 years time for a normal healthy individual. But then if we avoid, this is not the dental caries, this is the patient who's taken it forward. So yeah, we'll need to think about it.
So having that in mind, people always complain. Like people who come to me, they also then, can you give some medicines to relieve pain because they feel dentistry is expensive. So can you shed some light on that?
Yeah, I would. Just love this question actually. I want to address it from my point of view also. Many dentists have already explained, but I think I should also explain this once from my point of view. Personally, if you ask me, any patients when they ask me, what is my answer is dentistry is not expensive. Delaying your health is expensive. No matter what issue in your body. If you're delaying the issue, it is expensive. If you go, and one more thing with dentistry is what people see, they take it for granted. Abhi, if someone has a stomach ache and it is not going down for a day or two, they cannot see what is happening there. So they'll immediately run to the doctor. Doctor, it's not going down, it's like that. But in the mouth, some patients have ulcers which are not healed for months and months. You cannot leave any ulcer like that. Alhamdulillah, you are also a doctor, we cannot leave any untreated ulcers. But because they can see, they take the privilege, I'll keep applying medicine on and on and on. So then later on, it gets into a very worse scenario because they can see this is just this, it's okay. What you see is sometimes taken for granted for what you are not able to see. So I think delaying is the major thing. So as I told you for the before question also for the dental caries, when you come to me in this first stage, I will get your job done in an X amount. When you come to me in the second stage, I'll do it in 2x. But when you come to me in the stages of a root canal, I'll have to go for 10x because here I'm removing your nerve and I'll need to keep a nerve like material which is suiting, which is not irritating your body also because there is a nerve beneath. So when I'm giving you that, I'll need to go 10x. You have gone worse, you're coming up for the crown, I'll need to go 20x because you're chewing. And you're chewing force more than me. If I give you anything irrational, you cannot handle that also. So I am not increasing the cost. No dentist wants to also. We all like to practice conservative. We all like to protect what is natural. But if you don't delay, we can do everything you want. There are treatments, how we classify treatment is, first thing is what patient wants. Some patients say, second thing is what knowledge the doctor has. Third thing is key, what is the necessity of the patient. So we need to address the necessity, keeping in mind what I know, keeping in mind what the patient wants. But sometimes what patient wants we cannot do. They'll come with a bad pain, with a swelling. They'll tell, do a filling and send me. Do a filling and send me. I cannot do that. If I do a filling and send tomorrow morning, you'll come up with a big oozed up Ludwig's swelling. You'll have obstructive breathing, food intake, everything. So the job becomes a little tricky. What patient needs and my knowledge has to go hand in hand for taking up all of this and handling. I think what we are doing is pretty much valid. We can justify. So come to us early. We'll save your bucks a little. That's how we can guarantee. And scaling is much cheaper. Mostly in India, scaling is much cheaper. You can do a scaling. Once you do scaling, once the food is not impacted in your teeth, you'll not get cavities also. So you can save a lot with that also. So it's the patient's choice and decision key. I'll keep all my teeth. I'll save my teeth and I'll try to have them till the end. So it's their choice.
So talking about ulcers in mouth, oral cancer, as you have said, is a bigger concern now. So can you tell me what? how impactful it is for us in our practice and in our daily lives.
Hmm. So, basically, oral cancers, people, we generally know tobacco is one of the major cause of oral cancer in any form. Hans, Kutka, Mawa. There are a lot of forms. So, this one is the one reason. Second one being smoking. Third one being alcohol, followed by spicy food. Certain parts of Andhra do have a habit of taking hell lot of spice. So, in spice in itself causes an irritation. One more thing being our betel nuts. Betel nuts are very dangerous. And the fifth most common, but people don't know, is any sharp teeth or any sharp prosthesis, being the denture, being the crown, which is continuously irritating your mucus or your tongue, your inside of the cheek, anywhere, which is continuously irritating. You need to address it. If it is not like you'll keep applying a mucopain gel and you're addressing, no, it's not the way you address. You will address the cause. You will correct what is continuously irritating. And we tell any ulcer which is not healed for more than 2 months is highly susceptible to change into anything. So we need to make them heal. And the most common thing what we are noticing is there is a lot of late diagnosis. We are not able to diagnose early because people are like, இது என்ன இருக்கு வாயில அச்சரம் தானே, இதுக்கு நம்ம என்ன பண்ணோம், we'll apply. So no, even women patients we have seen who had zero habits have developed oral cancer. Tongue cancer, posterior part of the tongues, is being the most commonest cancer in the younger age group. So these are all certain things which we need to address. And oral cancer is actually a multifactorial thing. Ki I'm treating, you treating. We cannot go like that. Basically, we cannot go like that. We are all a unit. I think we all should involve together. Sometimes I have also noticed certain people don't have the knowledge to. Certain practitioners don't have the knowledge to identify or diagnose is it oral cancer in itself. That is also being one of the reason why the oral cancer diagnosis is being delayed. They are given just like that multivitamin or something, and they are trying to extend, prolong. When the patient came, like in my own practice, I have seen people who have told, for 3 4 months I'm being treated for this ulcer and I'm coming to you, and we diagnose and we have the first look, we identify, no, this is nothing normal. Then we get into for the biopsy, getting them to know ki this is not. And one more thing with oral cancer, which is very superb thing, before going into cancer, the oral cavity comes into a condition called pre-malignant lesion and pre-malignant condition. So it gives you a signal ki listen, this can change, I can change, please treat me. So then we need to look into certain symptoms that our body shows, like in the hand, if you keep rubbing you get a black color tissue, it's like a scar. But in the oral cavity, any irritation will cause something called a white lesion. First being leukoplakia, which is leukoplegia is a common precancerous condition, lesion. So what we do with leukoplakia, we just go to a doctor, we cut and remove the part, we nicely ablate it, we leave it, we reduce the chances of cancer then and there. Second most common condition being oral submucous fibrosis, where the patient cannot open their mouth itself. Their muscle tonicity goes, they stiffen, they cannot smile, the mouth opening reduces. With these patients, this is a little major. That also can be addressed without going for a aggressive cancer surgery. So you need to note what your body tells. Oral cancer is something which will surely give you signs like precancerous conditions and lesions. So kindly look into and address them. With this, you can avoid major taking off the jaw or taking off the part of tongue. All can be avoided because it affects your life very badly. So I would personally tell, listen to your body, address it then and there, and get done with it. So that's how oral cancers are going. And I think the government should also start opening pre-cancerous hospitals so that people can get the knowledge ki pre-cancer, so cancer se pehle I'll get it treated. Instead of cancer hospitals, I want them to rename pre-cancer hospitals. So somewhere the awareness starts with the people, so that is major thing. Even in our practice, if we tell it's a pre-cancer, the people are like, pre-cancer what? They have no knowledge. So it needs a lot of knowledge, awareness, and all that. Yeah.
They take it more like easily. Pre-cancer is not a
Hmm.
cancer, so why to worry about it?
Yeah, but it has 90 to 80% chances to convert. No, that is the major thing. They
They
tend to
fail to
neglect.
understand the gravity of the problem in that scenario.
That becomes very hard. I think this change should come from the system in itself, not just putting an ad in the movie theater कि इसको cancer हो गया था, इसका पूरा jonic नहीं. We need to aware them कि there'll be a before sign. There's no need to remove it for the whole. So we'll need to aware them a little more. So
So,
that's how we work.
talking about women's faces, hormonal disturbances, you see, there are many phases in women. They have pregnancy, menopause, and all these things. So, what role hormonal imbalances play in case of oral health and dentistry?
Oh, this is a very nice question, which women don't want to believe when we tell it's your hormones, but they have to believe. This becomes hard for us to put the point to them. So, first thing, what happens is, during the periods. First, we'll start from the earlier stage. So, during the periods, first thing is, you have increased progesterone. When you have increased progesterone, it plays a little direct on your gums. Some women tell they have bleeding gums, swollen gums during the periods when it starts, or a day or 2 days before the periods, and once the period is done, the symptoms regress. So this is a fair chance, and you need to believe this is your progesterone playing. So don't worry about it first. Second is when you get pregnant. When you get pregnant also, your hormones are too much here and there. There are certain particular, we there is a lesion called pregnancy gingivitis, which starts by second to third months of your pregnancy and can stay up to 8 to 9 months, post which your hormones are in the balance, it goes down. In this condition, your gums are swollen, they are bleeding, they have a bad dull pain throughout the pregnancy. So what we tell to the patient, of course your hormones are playing, but you cannot blame your hormones totally. So in particular, in my practice, I have made aware women about it. If you are planning a pregnancy and you're serious about it, we would particularly want you to get a proper scaling done before you plan up your pregnancy, because maybe hormones are playing, but whatever dirt and bacteria is sitting there is also being a contributing factor. They both are going 50-50. If your hormone is only doing, it will do 25% damage, but if the toxins and acids everything are released together, it will do a major damage for you. So this way we can prevent more of the pregnancy thing. There is something called pregnancy tumors also, granuloma. They develop a lump of gums growing here and there in their mouth. That is also due to pregnancy, but mostly we have seen they don't regress by themselves post pregnancy. For that also there is a reason ki certain oral bacteria which are like biome contribute to it. So later stages we'll need to remove it, but still that is also there in the pregnant woman. Menopause, of course, menopause, why we are seeing symptoms is due to decrease in estrogen. With decrease in estrogen, what happens to the patient is they develop a symptom of dry mouth, burning mouth. Dry mouth is something where the saliva in itself is reduced. When the salivation is reduced, what is there else to clean your mouth? Your saliva is continuously lubricating it and cleaning it. When you don't have saliva, of course, you will develop a lot of cavities. The food is stuck to your tooth and they experience cavity, gum issues. They are not clean. Second thing, what in menopause they see is uh, one is dry mouth, one is burning mouth. Anything and everything they put into the mouth, or the mouth is normally kept also, they are sitting normal, even then they have this burning sensation continuously. So these symptoms are seen and these can be addressed also. So this can be, and one more hormone like to talk about is stress hormone, cortisol. Cortisol levels also affect oral biome there. What happens with cortisol or our stress hormones is there is a lesion which is also a pre-cancerous lesion. It is a very less contributing for cancer, magar it is a majorly related to stress. The lesion is called lichen planus. It is a lace-like whitish lesion on your on your buccal mucosa elsewhere in your mouth. So this also, for this we do treat with a certain medication, but the major factor being get yourself de-stressed. Once the hormone also falls in place, that will surely help you in a lot of ways. So this will be my major lesions which I would like to talk about for the hormone related ones. Hope that helps you a little.
So, with this, I'll ask you a few questions about rating
Mhm,
foods according to the oral health. So,
mhm.
first is dairy products, rate it out of 10.
Dairy products are good. I will not tell they are bad. You just need to learn to balance them because a lot of them have calcium in them. Cheese is a very good product you can give to your kids actually. Like they have a certain they can prevent cavities also. Cheese can actually prevent cavities. You can give cheese to your kids, and they also help in maintaining your oral pH level also at times. So yeah, milk I will rate 8. But you should know how to use. But if you give them a feeder bottle, they keep it in the mouth and they sleep, then milk is 0. It will cause nursing bottle and early cavities. So it depends how you use it and how you take it. So I would always suggest, if you give your kid milk, it is always okay post drinking milk, ask the kid to drink or take 2 sips of water. Don't let it stay. That's how you can maintain. Other than that, they need a lot of milk also for themselves, unless it's healthy. Yeah.
So pickles.
Pickles, I personally would give it 4 or 3, less than that also. But a lot of people like pickle and cannot leave. I'll give him 3. I'll give the pickle 3. Pickle are highly acidic. They change your oral pH level. For a cavity to happen, your pH level should be acidic. So they cause lot of acidity, and they also cause lot of stains. And not only for the oral cavity, they are not good for your body also. So pickles, I'll give 2 or 3 only. I'm not majorly a great fan of them. Some people soak it with vinegar and all. Then I'm giving it a big no. No, it is highly acidic. So yeah, pickles is a no from my side.
Okay. What about beverages, juices?
No, I'll give 0. I will particularly tell you, if you have a kid at home, you give them 0 beverages, and at least till the age you can hold them and not let them have. So beverages, I'll totally give them 0. They are highly acidic. They will erode your enamel. They'll develop lot of sensitivity. So no. Some people will ask me sometimes, rarely, can I use it with the straw alone? I will drink. I will not touch. I'll let them touch in my teeth. I'll directly not practically not possible at all. So no, 0.
So what about dry fruits?
Yeah, yeah, dry fruits, I'm very satisfied. Yeah, you can surely give those to your kids. But some kids who have cavities and all, they get it stuck here and there. So once they have had it, you can ask them to rinse, you can clean it off. But dry fruits is a must. Yeah, they dry fruits can beautifully maintain your salivary pH level. That can prevent cavities also. So I will give 9. You just need to know when to eat, how much to eat. So I'll give you 9 for the dry fruits.
What about fishes?
Yeah, yeah, fish is very good. Fish you can give, but for the pediatric and geriatric patients, what we are seeing, they cannot properly eat the fish. Sometimes the fish bone is stuck here and there, so that becomes a complaint. So if you have kids, if you can do it and you can give it to them, yeah, kindly give them a lot of fish, lot of salmon omega for the brain development and all. Kindly give them. It's a 10 on 10, but sit before, look into when they are eating, and give them a lot.
Provided we have to remove the bones. If
Yeah,
it
we'll
is
need to
something
do the
else.
homework. Yeah, only then you can give it to them. And 2 more foods, even if you're not asking, I would like to add. In India, particularly, people have habit of drinking lime water daily in empty stomach.
Yeah.
I would rate it 2 or 1. People will be against me for this. She's giving Nimbu Pani 1 or 2. I know this is going to create a lot of hate against me, but yeah, what is it even doing? You're sleeping, you're waking up, your oral biome is good, you're maintaining everything. You're waking up and you're putting a lot of acid into your mouth. And Nimbu Pani or lemon water is something people want to cherish, enjoy, and drink. So they hold it in their mouth, then they take it in. So you're unreasonably letting your teeth get exposed to acidity on a long time, and continual use of lime water, they can surely be tooth sensitivity. And people with tooth sensitivity will surely have high symptoms when they take lime water. So lime water, like sometimes, at times, but not regularly. So I would like to tell no to a lime water, and also to some people drink apple cider vinegar. Early mornings they take apple cider vinegar. So apple cider vinegar is also highly acidic. So I will rate that also. I know it has its own benefits. People kindly understand. Right now, I'm talking in the perspective of my own branch only. So I'm actually rating apple cider vinegar for a 3 or a 2, because they erode your teeth and sensitivity. Once it comes, once your enamel is gone, It's non-negotiable. It's gone. I cannot do anything. I just need to fill and cover it up. So I will tell anything which will not come back, kindly save it. So avoid all these things. So that's
Okay.
why apple cider vinegar.
So with this, we have come to the end of the session. Let me check if I have further questions.
Yeah, sure, sure.
So, okay, yeah, we are done. So, thank you so much, Doctor, for your insightful session, and I hope our viewers will get more of like exposure to what we generally miss out in our daily practices. With
Yeah, yeah,
this,
surely.
yeah, with this, we are ending up the session. This is me, Dr. Arshia, signing off from Psych Talks. Thank you, and stay tuned.